talking about protective sensation, and yes, there is absolute agreement that the failure to feel a monofilament or to feel 2 or more touches with the toes test, or the touch test, I should say, is considered to be indicative of a high-risk patient who's lost protective sensation. So statistically, we would say it's a very specific test, very specific. If you can't feel those, you know the patient's in danger. The problem, of course, with it is that it doesn't mean it's terribly sensitive. And this diagram, I hope, will help to show why. And as you'll see, the fibers that actually detect light touch, they're the A alpha and the betas, are large myelinated fibers. So they are more difficult, apparently, metabolically to attack. They're certainly protected by myelin, by a nice insulation layer. But as we move down and move to the right of the diagram, you'll see that the smaller fibers are the thinly myelinated, the A delta, and the C fibers in particular are the ones that actually perceive pain
and they're less well
and
protected.
Temperature, and they're the most, therefore should be the most vulnerable, you would have thought.
Yeah.
And I think we were speaking before about this. I actually looked at, when I started getting interested in this about 15 years ago, maybe a bit less, I found, fun enough, from Manchester, I think it was a nearly 10,000 patient cohort study that was looking at this. It was a cross-sectional study, at the very least. I don't think it was longitudinal, and it was looking at all the different methodologies of testing. And they were, of course, using monofilament, and they were using, I think, probably either the Michigan instrument, or they were using something similar. And I thought to myself, well, I can't believe it, because once again they've said, monofilament, absolutely fantastic. If you do monofilament, and everybody's equipped with their monofilaments, now with their fingers, and you can predict neuropathy with that, well, at least you know that you can show that the patient's at high risk because they've lost protective sensation.